Dr. Cadlick, I'm going to put you on the payroll, man. Earlier, you were responding to Senator Smith regarding a possible bill. We have that bill. Public Health Emergency Fund actually stimulated by conversations with Dr. Frieden, and he said that in the Ebola crisis, there was 10 different authorizations that had to be signed off on before he could get somebody to travel emergently to Africa. Kind of crazy. And I kept on contrasting the authorization process we were going through, which was cumbersome and slow, with that before and after Katrina. Before Katrina, FEMA had to come to get the initial dollars. After Katrina, Congress recognized that's not the best way, so there's a pot of money that can immediately be accessed. And if it goes over that, then they come back and get another authorization. So Dr. Schatz and I have put together a bill that, one, waives these contracting requirements for that immediate period, so you can actually deploy people. And secondly, based upon, and Dr. Cadlick, this is where you nailed it, upon the previous 14 years of public health emergencies, we take the average of that expenditure, and we make those dollars available up front to be immediately drawn down. Still accountability. GAO is going to do a report, make sure that the CDC hasn't used it to go to Hawaii for a conference as opposed to Africa to fight Ebola. No offense, Dr. Reddit, but still, the point being that we would have the accountability built in, but we think it's a good bill. Now, let me move on to something different. Dr. Red, I was struck speaking to people after Zika hit, that in retrospect, and of course everything in retrospect, if I could do things in retrospect, I'd be a millionaire on the stock market, but in retrospect, you could have kind of predicted what was going to happen, because supposedly Brazil was flying in folks from the South Pacific to work on their Olympic stadiums, that Zika had been breaking out in the South Pacific where these workers were coming from. Brazil is like a petri dish for Zika, and you could have predicted it. Now, of course, it's retrospective. But the thought occurs to me, with big data, we can actually put in travel patterns, we can put in areas of receptivity, we can put in where there are outbreaks, and make some, at least first blush, guess as to where the next epidemic is going to be. Is that just me sort of, wouldn't it be great sort of thing, or is this something practical, and if it's practical, is CDC doing it?
I agree with your overall statement. I think another way of looking at this is that the pathway that Zika followed was very similar to chikungunya just a few years before, where it existed in the Pacific, and then caused big outbreaks in Brazil and in South America. Another point that is the same is when we had outbreaks in the Caribbean, we knew locations of lots of travel to the U.S. and where the vector was the Aedes aegypti mosquito lived. It's the same place that we've seen small dengue outbreaks in the past.
So can we use this predictively? Because if we could use it predictively, if we could see, well, the Brazilians are going to be having this problem, let's go down there and encourage them to spray for mosquitoes, et cetera.
I think it's hard to do that. I think that the vector is very resilient, and there were some questions.
Now, I was just giving the example of spraying mosquitoes as a concrete action, but what I'm asking not about is the vector resilient. Can we use big data just to look at travel patterns where there's an outbreak and guess where there might be a spread of such an outbreak?
I think we can. I think the challenge is, what do you do with that information, and is there a way to use that, for example, to have prevented the Zika outbreak in Miami-Dade County? I think that the things that you do...
So you're ahead of us. What you use with the information is different than if you can actually acquire the information. If it's practical and right, if you will, to acquire the information, are we putting such systems in place?
Well, just to take the Zika example, there was a lot of communication with Texas and Florida, Louisiana, the Gulf Coast areas that have the Aedes aegypti mosquito, recognizing that.
Okay, now you're still after me, because that's after it hit Brazil and after we knew that there's going to be travel from Brazil up. I'm actually trying to go proactively before that, in that we could see the Brazilians were bringing in lots of workers from the South Pacific, and therefore it was predictable that whatever was breaking out there was going to break out here. Now that is taking the battle to the enemy, if you will. Are we doing that? Do we have a worldwide kind of map, and I've seen such a map of hotspots of infectious diseases, overlaid with travel patterns, to guess whether or not, and I understand CDC has worldwide outposts, So again, I'm asking something more kind of closer to the point
Sure.
than whether it gets to Texas.
I think the quality of information is variable. I don't think we have the same. For example, I think the information we have about influenza is much better than we have about all the vector-borne, all the mosquito-borne diseases that are out there, where we know what viruses are circulating in China because of the known importance of influenza and the risk it poses for a global pandemic.
Now, I have seen maps, though, and I'm over time, and I'll stop after this, but I have seen maps put out by CDC and World Health in which it shows, oh yeah, here is this and there is that, and it's a hotspot of a particular virus. Can that not be, again, overlaid with travel patterns?
Well, there are parts of the world that some of the discussion earlier about the number of zoonotic diseases that are detected that cause infections in humans. There are certain parts of the world that are more prone to those emergences. I think again, your question is how do we use that information? We certainly do have travel maps of where people travel to and from. We have information about where various diseases occur at variable disease degrees of granularity. And I think those two things do go together. I think how we would use that to take a preemptive action is really I think that's the question that you're getting at.
Okay, I yield back.